All right, let's get right into it. Today we're talking about something called bradycardia. And really, all that means is a slow heart rate. We're talking anything under 60 beats per minute for an adult. So that leads us to the big question, right? Is a slow heartbeat a good thing, like a sign of being super fit? Or is it a red flag that something's gone wrong? The truth is, and you're going to see this, the answer is, well, it really depends. Okay, check this out. It's a perfect example. You've got two different people, right? But look at their heart rate. It's the exact same, 45 beats per minute. Now, for the elite athlete, that's fantastic. It means their heart is incredibly efficient, totally normal. But for the patient on the right who's feeling dizzy and even fainting, that same number, 45, is a huge danger sign. This tells us something absolutely crucial right from the get-go. The number on the monitor isn't the whole story, not even close. It all comes down to how the person feels. So to really get a grip on what happens when things go wrong, we've got to first understand how the heart is supposed to work. And honestly, the best way to think about it is like this amazing, perfectly timed electrical system. It's got its own built-in natural pacemaker. Imagine a little four-step relay race happening inside your chest with every single beat. Step 1, the spark. This comes from the sinoatrial node, or SA node. This is the boss, the master pacemaker. Step 2, the spread. That electrical spark travels across the top two chambers of the heart, the atria. Then, step 3, and this one's super important, the pause. The signal hits the atrioventricular, or AV node, and it just waits for a split second. It's like a gatekeeper making sure everything is timed perfectly. And finally, step 4, the squeeze. The signal gets the green light, spreads through the big, powerful bottom chambers, the ventricles, and causes them to contract, pumping blood out to your entire body. So just remember that. Spark, spread, pause, squeeze. That's a perfect heartbeat.
Okay, so that's the ideal relay race. But what happens when it slows down? Well, the first kind of trouble we can run into happens right at the beginning, with the spark. It's when the main pacemaker itself starts to get a little lazy or just falters.
And this can happen in a couple of ways. First, you have what's called sinus bradycardia. This is when the main pacemaker, the SA node, is still in charge. It's just firing a bit slower than usual. A lot of the time, this is totally harmless. You see it in athletes, you see it when we sleep, no big deal. But what if that main pacemaker just gives up? Well, luckily, the heart has a backup system, the AV junction. If it has to take over, we call that a junctional bradycardia. Now, it's great that it's there, it's a protective mechanism for sure, but it's not as good as the original. The heart rate is slower and the whole system is just less efficient. All right, so that's one set of problems, issues with the pacemaker itself. But there's a whole other category. This is when the pacemaker fires perfectly on time, the spark is there, but the signal gets bogged down, delayed, or even completely stuck somewhere along that electrical highway on its way to the ventricles. We call this a heart block.
Let's start with a first-degree AV block. I know, the name heart block sounds terrifying, right? But this one really isn't a true block at all. Think of it more like a consistent, predictable traffic delay. Every single signal gets from the top chambers to the bottom, no problem. It just takes a little longer to get there every time. And honestly, this is usually harmless, and most people don't even know they have it. Remember our relay race analogy? This is like a runner who always hesitates for an extra second at the checkpoint before passing the baton. They never ever drop it, but that little hesitation is always there. The race is a bit slower overall, but hey, the job gets done. That, in a nutshell, is a first-degree AV block.
Okay, but things start to get more serious when we get to second-degree blocks, because now our runner does start dropping the baton sometimes. There are two types. First, there's Mobitz I. With this one, the delay gets progressively longer. A little longer, even longer, and then boom, a beat is completely dropped. But here's the key. It's predictable. You can see it coming. Now contrast that with Mobitz II. Here, beats are just dropped, out of the blue, suddenly, with no warning at all. And that's what makes it so much more dangerous. It's a more unstable rhythm that can flip into a complete block in an instant.
And that leads us to the most serious one of all, third degree, or what we call a complete heart block. This is, well, it's a total breakdown in communication. The electrical wire between the top and bottom chambers has been completely cut. They are totally disconnected, no longer talking to each other at all. The atria are doing their own thing, and the ventricles are beating to a completely different, uncoordinated drum. And the result of that disconnect is, frankly, electrical chaos.
The ventricles are left to fend for themselves, relying on a very, very slow and super unreliable backup rhythm. We're talking maybe 20 to 40 beats per minute. If you look at an EKG, there's absolutely no relationship between what the top chambers are doing and what the bottom chambers are doing. And as you can imagine, this almost always causes severe symptoms. This is a true medical emergency, no question about it.
So we've gone through all the technical stuff, the what of bradycardia. But now let's get to the really important part, the so what. Why does a slow heart rate actually make you feel sick? Why does any of this even matter? It really all boils down to one simple but super powerful formula. Cardiac output equals your heart rate times your stroke volume. Now, cardiac output is just a fancy way of saying how much blood your heart is pumping out every single minute. And stroke volume is how much blood gets pushed out with each individual beat. Simple, right?
So let's use that formula. What happens if your heart rate tanks? Let's say it drops way down to something like 35 beats per minute. What's the consequence?
Well, you don't have to be a math genius to figure this one out. If that heart rate number in our equation plummets, your cardiac output is going to plummet right along with it. And that is the whole problem. It means less blood is getting out to the rest of your body. Less blood means less oxygen for your brain, for your organs, for everything. Your body is literally being starved of the fuel it needs to run. And that's where the symptoms come from. They're not random. When your brain isn't getting enough oxygen-rich blood, what happens? You feel dizzy, you get lightheaded, maybe you even pass out. When your muscles are starved for oxygen, you feel wiped out, incredibly tired, and short of breath. Every single one of these symptoms is a direct result of that drop in cardiac output. But here's the good news. When a slow heart rate does become a problem, we have a really clear, well-established playbook for how to manage it.
And the entire game plan hinges on one single question. Is the patient having symptoms? If the answer is no, if they're stable and feeling fine, then a lot of times we just watch and wait. We'll look for causes we can reverse, like maybe a certain medication they're on. But if the answer is yes, if they're feeling dizzy, fainting, or showing any signs of being unstable, then it's a completely different story. It's an all-hands-on-deck emergency. The only goal is to get that heart rate up and restore blood flow now. And we'll use things like atropine or even electrical pacing to do it.
Now, for those really serious ongoing electrical problems, like that dangerous Mobitz 2 block or a complete heart block, the long-term fix is usually a permanent pacemaker. It's a pretty amazing little device that gets implanted under the skin, and it basically takes over the job of the heart's broken electrical system. It makes sure the heart keeps beating at a safe, steady rhythm, day in and day out. So this all brings us right back to where we started. After looking at how the heart works, what can go wrong, and what it all means, we can see that the most important question to ask isn't really how slow is the heart rate. The real question, the one that truly matters, is how do you feel? Because a heart rate of 45 in a healthy athlete is a badge of honor, but that exact same heart rate in someone who's passing out on the floor, that's a medical crisis. At the end of the day, it's not the number on the screen. It's the symptoms, or lack of them, that tell you everything you need to know.